This conference will now be recorded.
All right, thank you so much for joining us today for the Fredericksburg Regional Continuum of Care Funding Interest Session. This is the first time that we have offered this webinar. The Funding and Performance Committee wanted to ensure that anyone who was interested in applying for funds with us knew what the funding availability was throughout the year, as well as having lots of time to discuss projects with the Continuum of Care. That way, when an application comes available, that you are able to have a really thorough and complete application that you've already had some thought about funding for, rather than rushing to get an application done with us. So we wanted to provide you some background information on our funding process, as well as that funding that flows through the CoC, so you can start to think through some funding that you would like to apply for some of your projects. I will ask that during the presentation, if you please stay muted so that we can make sure we don't have any feedback. If you are on the phone and I have to mute you, I will not be able to unmute you. So just keep that in mind. If we could, I think it might be easier to just save questions till the end. You can put them in the chat so you don't forget them. And then I'll just address all of them at the end. And then if you need to rewatch this is being recorded, so it'll be available on the CoC YouTube channel within 48 hours of the presentation. All right, so today we are going to go over just brief introductions and a background of our funding process and all of the funding opportunities that we have throughout the year, and then we'll close out with questions, and we can take those in what you've heard today or any questions about projects that you would like to talk about. So just so you guys know who we are, I am the Continuum of Care Program Director at the George Washington Regional Commission. So I oversee the CoC and all of our funding processes, but we do utilize a Funding and Performance Committee who helps us with making funding decisions. They consist of Kristen Gallick, who is our chair at the Fredericksburg Department of Social Services. Clay just got elected, and he's from Chrismar Realty. Dee Smith with Central Virginia Housing Coalition. Emma Miller Richards from the Community Foundation, and Sarah Walsh from the Rappahannock United Way. So just give you a brief overview of our funding and how it works. Most of the funding that the CoC provides does not actually come directly from the CoC, but rather the George Washington Regional Commission, which is the CoC's lead agency, submits applications on behalf of the community, therefore determining who the federal, state, and local entities should fund. We'll go through each of those and kind of talk what that means, but all of our grantees have to go through a CoC local funding process in order to receive funding from another entity. And so that usually entails our HUD CoC program funding, our Virginia Homeless Solutions Program, which is our VHSP funding, Housing Trust Fund, and our local Unsheltered Homeless Initiative funding. We do have two documents that really dictate how we make funding decisions and what that process looks like. Both of these are available on our website. The first is the policy priorities, and this really outlines the key considerations that the funding performance and board take in making decisions around who we will and will not fund. So if we have struggles of being able to fund two projects, we really rely on the funding priorities to determine which project may get funding over another, because that's where a gap is. So that's what we look at, and these are passed every year. And so the newest ones for 2021 are available on our website. We also have funding policies and procedures that outline the process for how you apply for funding, how you ask for a letter of support or a letter of endorsement, and how we actually go about reviewing, ranking, and selecting the projects that we do. These are reviewed and updated each year by the Funding and Performance Committee, and so the most recent ones are available on our website on our funding page. Just some basic funding eligibility so that you're aware. In order to apply for funding, you must be a member of the CoC. I believe everyone who's on the call today is. But if you have any questions about your membership, please do not hesitate to reach out. Becoming a member is very easy to do. There is a short application, and then you're able to be a member. You also, by accepting funds through the CoC, have to adhere to our coordinated entry policies and procedures, and these are available on our website. They outline how people experiencing homelessness flow through our system, and so you have to be a part of that system. And what that means is you follow a housing first model, so there is no preconditions to receiving your services. We always strive to have people go into housing and then wrap services around them, and that's the housing first model that we all follow. You then also have to participate in the coordinated entry process. So we have a homelessness hotline. You have to take referrals from there. You have to go through our prioritization process in order to select people for your housing projects. So that's the coordinated entry, and how people do that and what that actually looks like is all outlined in the policies and procedures on our website. And then you must adhere to established project standards. Each of our projects have community standards that the CoC has adopted about what our general expectations are for each of those projects. And so if you will receive funding for a project, you have to adhere to those. And then you have to use HMIS or a comparable database for our DV providers. And that's how all of our grants do their reporting. So HMIS participation will be required if you receive funding from a continuum of care funding source. And then finally, you have to meet the eligibility requirements of any of the funding agencies that we're receiving funding from. And each of those are usually outlined in the individual entities funding guidelines, and more information becomes available on eligibility when applications actually open up. And so just briefly how funding in general works. Usually when we receive that we can apply for funds as a community, we will release a notice of funding, applications and scoring sheets, so you know exactly exactly what we're looking for ahead of submitting your application and how you'll be ranked. Your project applications will be received by our set deadline. The Funding Performance Committee will then review and score all applications. Of the applications that they receive, they can either choose to accept or reject each application, and then if they do choose to accept it, they can accept it at the full amount that was requested or at a reduced amount. They then take all projects and order them in priority of funding, so that way if we don't receive all the funding that we requested, that we go down the list. And keep giving out funds until all funds are released. So your rank really matters when it comes to your project, not just that you were accepted. And then finally, we will notify projects, and there's an appeals process that you're able to use if you for some reason feel like you were unfairly scored or left out. We always have an appeals process for all of our funding opportunities. All right, so I'm just gonna go through the available funding that we have throughout the year. And starting with, we do have federal funding. So these come from the HUD CoC program funding. It is a 1-year grant cycle. We are told each year how much we are able to apply for. And so when we submit our collaborative community application, including all of the applications that have been selected and accepted by the Funding Performance Committee, we will not go above what we are able to apply for. Once applications are accepted as part of a ranking for that, they're submitted for HUD, and then HUD actually determines who is to receive projects. So even though the CoC determines that you're included in our collaborative application, basically our request for funding, HUD will determine whether or not you will actually be funded from what we tell them our community has ranked. And so once awards are announced from those requests, you will actually receive a grant agreement directly from HUD. So the CoC includes you in the application and actually allows you to request the funds, but all grant agreements once selected by HUD are with HUD directly. And so for that program, there are 5 options for what you are able to apply for. Eligible projects include permanent supportive housing, rapid rehousing, joint transitional and rapid rehousing, and supportive services. And that's basically the coordinated assessment project. And then there is HMIS funds, but these are only able to be applied for by the HMIS lead. And so usually we anticipate that applications are due around September or October. I have not yet heard anything for the 2021 application process, but usually that's their timeline. Last year it was canceled due to COVID, and they ended up just renewing the projects they already have, but I have not heard either way about whether or not they're going to do that again this year. Once we submit our application, it takes them a little while to review them and make determinations because they are doing applications for everyone across the country. And so we usually receive awards around March for those applications that were submitted in September. And so just to give you an idea about how much funding comes along with that process, we are usually eligible for around a little over $300,000. That's what our amount was in 2019. There's always bonus funding, and so that was about $23,000. And then they added a domestic violence bonus for domestic violence projects, which was about $50,000. And so these numbers come out when they release the HUD application for communities to submit. But usually this is how it falls for our community. We don't see a large growth each year. So right now we have 4 projects that are funded under this funding source, which is an HMIS project for the George Washington Regional Commission, 2 PSH projects with MICA, and a DV rapid rehousing project. And so the interesting thing, just so you know, about ranking for this funding source, as I mentioned, they do tell us how much we're going to apply for. And so when we rank projects, we rank them in 2 tiers. The first tier is 94% of what our renewal amount is allowed to be. And so those projects pass eligibility and threshold, and then they're conditionally selected from the highest scoring CoCs across the country. So usually we know pretty well that anything that's in tier 1 will be funded by HUD. And then for tier 2, it's whatever is left over of our renewal amount, but it's able to go up to the leftover renewal amount plus the 50,000 DV project, if all projects were accepted that way. And so they actually take all tier 2 projects and rank them separately outside of the CoC in which they came from, using the point scale here. And then they're able to take and fund what they're able to fund. So what you actually end up having is you might have a straddler project, depending on how much they apply for, that falls between tier 1 and tier 2. HUD can fund tier 1 amount and may not fund tier 2 amount, and so that project may lose a little bit of funding. If we're given the bonus, we could grow our overall renewal amount each year, but it becomes really complicated about how you fall. So this is an illustration from 2019, how that fell. So that 300,000 amount, a little bit was in tier 1, a little bit was in tier 2, and then we did receive the 50,000 DV bonus, and so this is how it ended up falling. But we had some projects that might have fallen even between a little bit of tier 1 and the DV bonus. And so the requirements for HUD funding is you do have to have a 25% match, and you are required to do HUD reporting. All of those reporting requirements have to come from HMIS, and so that's why that HMIS participation for these projects is required. You will download the Excel file and upload it to HUD's reporting software. There's also federal remittance process. So you do have to sign up through a pretty lengthy federal process in order to get access to their software that allows you to actually submit your remittance for reimbursement. And then your first remittance will have lots of documentation for every line item that you put in, and then it's pretty easy from there, but it can be lengthy to just get set up. But once you're set up and you're used to it, it's pretty easy to continue to go through. So that is our federal funding. That is the only federal funding that goes through the CoC at this point. We do have a couple of sources of state funding. And so for state funding, our largest source is the Virginia Homeless Solutions Program, which is VHSP. And so there's a number of project types that you're eligible for to apply. That includes street outreach, so trying to connect people who would otherwise not connect on their own to the homeless system. Coordinated assessment, which is like our homelessness helpline. Targeted prevention, which is preventing people 14 days out from literal homelessness. Emergency shelter, rapid rehousing. CoC planning is only for the CoC lead agency, and then you are eligible to apply for HMIS funds and administration funds. So the HMIS and admin money will help you with paying for costs around actually doing the requirement of HMIS and administering their program. Usually applications are due around March and awards are made in May. This funding is a 2-year grant cycle, so only every other year do we accept new applications for this. In 2022, when that gets released in March of 2022, we will accept new applications. So I would start thinking about if this is a project funding that you would like to apply for. So you apply, the way it works is we apply for any amount that the community feels that we would like to request in year 1, and then in year 2, we are eligible usually for the same amount that we were awarded from year 1. So once the community amounts received, we fund all projects based on your ranking. So if we asked for $1.4 million, but we only got $1.1 million, we will fund the top projects until all funding is allocated to those projects. If funds for any reason are not adequate to make the project viable, then funds go to the next project. And so this summarizes some of that, but basically in the past, what we have received is a little over $1 million, and these are the projects in which they fall. So we have project funding in each of these categories that's available for us to apply for, and we receive a little bit over $1 million. HAFWA is also included in this application, but not in this number, as they're a little bit different of process. And so for VHSP, there's also a 25% match for that funding. And that is an interesting funding match, as it does not necessarily have to be for the project in which you receive funding for, but from one of the eligible projects. So for instance, if you receive VHSP funds for a rapid rehousing project, but you don't have match in the rapid rehousing line item of your agency, but you have funds that you're spending on a street outreach project, then you can use those as match, as long as you're not using it as match for another project of another funding source. So it's just across the community and across all eligible line items, the 25% match has to be met. And then there is VHSP reporting. We use the state software in order to do those reporting. They are on 6-month reports, so you'll have a halfway point report as well as an end of the year report for any projects you receive funding for. This funding is on a fiscal year, July to June, so it'll run along with the state funding. And then there is a state remittance process. You will submit any Excel forms and all accompanying documentation to the state software in order to receive your reimbursements. Just like the HUD funding, you will be included in the request for CoC. And then if funded, you will have your grant agreement be directly with DHCD, Department of Housing and Community Development, who runs this grant. The Department of Housing and Community Development also runs the Virginia Housing Trust Fund, which you are eligible to apply for if you would like funding for a rapid rehousing project, a youth innovation project, older adults innovation project, permanent supportive housing, and administrative costs. This is a 1-year grant. It is on a calendar year. I will just give the caveat that even though applications come out around October to be due in November, and then awards aren't usually made till January and February when you already could be expending funds. So it's been difficult in the past, but usually they're able to prorate anything that you've spent so far. You're able to go back and get retroactive reimbursement for. Last year, there was not a cap on the number that you could ask for, and you can ask for multiple projects from your agency as well as multiple projects from the community. So rapid rehousing is a rapid rehousing program. A youth innovation project is a project that's trying to do some new model in order to help with youth homelessness. That can be for things like host homes or shared living situations, or rapid rehousing with some changes and leniency to the homeless definition around youth, because a lot of youth are not on the street for literal homelessness, but they're in some doubled up situations. It doesn't always make them eligible for rapid rehousing in the traditional sense. Any of those youth innovation projects do have to have a planning portion to them, which includes youth with lived experience in the planning process of that. So just keep that in mind if that's something that you would like to apply for or think about. All the details for that project are in the VHSP guidelines under the Housing Trust Fund section. Same thing with older adults. It can be for things like residency homes for people who are needing a little more care but are homeless, shared housing, or even rapid rehousing. Again, if you are going to do a project, there does have to be a planning component for that, and you do have to incorporate an older adult, which is 50 plus, for having someone be able to fill that lived experience feedback as you plan your project. So for Housing Trust Fund, it comes from the Virginia pot, which is over about $30 million. Of that $30 million, about 40% goes to targeted efforts to reduce homelessness. And so in the past, we've been able to receive funding for a number of different projects, but our current funded project is Micah's Permanent Supportive Housing. They received some beds for that. And then Micah also has a rapid rehousing project targeted towards older adults. For Housing Trust Fund, it's a little bit different than our other application processes. The CoC does not submit the application for Housing Trust Fund. If you are, as an agency, would like to apply for the funding, then you submit the application. However, the project must be developed with the CoC, so it's not a project that you can just apply for on your own and we have never heard of. We actually help in the development of that project. While you submit the application, there is a required CoC letter of endorsement in which I actually outline how this fits into our overall homeless plan and how we have partnered in the development and implementation of that project. The CoC also requires that in order to receive that letter of endorsement, we will review your application prior to submission and provide technical assistance on your writing and any data or anything else like that to make it a really strong application for you to submit forward. There is Housing Trust Fund reporting similar to VHSP. It goes through the same software that the state uses for those funds. And then finally, you submit all your remittances for reimbursement directly to the state in order to receive that funding. And then finally, there is currently one source of local funding that the CoC has flowing through them, and that is our Unsheltered Homelessness Initiative funding. This is Rapid Rehousing Project that we have partnered with the city and Mary Washington Hospital on for the last 3 or 4 years, I guess it has been now. So what we do is we have an administrator chosen for a 2-year grant cycle, and our funding varies each year. So any funds that we actually receive for the project during the 2 years that the administrator is chosen, we continue to add it to your pot. GWRC is the fiscal agent for those funds. So you would contract with GWRC and receive remittances directly from us. Just to give you an idea about what the funding has been like each year for about the last 3 or 4 years, it's been $20,000 a year in local funding and Mary Washington funds. This year, we did receive a little bit of increase from local funding. So far, we have $20,000 in just jurisdictional funding, and we do plan to go forward to ask for additional funding from Mary Washington, which would increase that a little bit more. We will be looking for a new administrator or renewal of the administrator that we should currently have in 2023. So just keeping that in mind, if unsheltered is something that you would like to do a rapid rehousing project for, that is an option as well. All right, so those are our basic funding that we have available through our CoC process and an overview of the funding process in general. I am happy to answer any questions that anyone has at this point.
Sam, can you hear me? This is Juanita.
Yes, I can hear you.
Okay, so the one question I have on the when you talk about the housing first model, and that what that means is accepting housing first, and then wraparound services can be provided. So does that mean, so for example, when you talk about the people that we service, right? We recognize that they need housing, but also but also we look at more than just the housing piece of it. We also, part of them being in our program means they have to also complete sign up for the Right Road program, but complete our training program, the mental health piece of it, the substance abuse part of it. And then we have the Courage to Change, which is basically a year-long training. And then housing is a piece of that because we recognize that that's the housing is needed. So when you talk about the housing first model, does that mean we can include that as part of the Right Road program?
So housing first basically means that if housing is available, then there should be no preconditions for housing. So if being sober or being mentally well or going through some kind of budgeting program or all of those things is the only way in which you can get to housing, then that's not housing first. However, if you are able to allow them to go to housing and work with them to participate voluntarily in all of those programs, not as a stipulation to receiving housing, then that is fine. But the requirement of services in order to receive housing is not housing first. Does that make sense?
It does.
Yeah, so yeah, it's not you have to be in housing, then I offer you these things. They can start before, they can start at the same time, but it's just when a door to housing is ready, like they locate housing, it's not that you have to go through all these steps in order to get into housing, but you still offer all of those services is fine.
Okay, I'll get it. Thank you.
Any other questions? Like I said, we are at the CoC are really excited to talk about any potential projects that you have and determine if there is a funding source that we offer that would be a good fit for your project. We would rather have conversations about projects when we're not rushing towards an application deadline. So if you do have projects that you would like to talk about or ways in which you would like to further your involvement in the CoC or our efforts to end homelessness, we would love to talk to you about what those are so that we can determine how to fit you into our system and our funding options. So you can always reach out to me. I'm going to send out these slides to the membership so that you have them, but you all have my contact. So please let me know if there's a project you have in mind or even a gap that you're noticing and there's something we can develop together about what might be a good fit for your agency and the populations you're trying to serve. All right, if there are no other questions for this call, then that's all I have for you this morning. But if you have any questions that you don't want to talk about now or you want to send me an email directly, I am available. But I thank you guys all so much for jumping on. I'm excited to see new agencies than what we usually have, being interested in funding and hearing about those. But if there's any confusion, I know there's a lot of information today, and some of it can be really confusing, but we're here to help provide you with what you need to think about the funding that might be an option for you. Yes, Kim, I saw your question in the chat. I will definitely send the PowerPoint out to all of you who attended and all the members. All right, well, I hope you guys enjoy the rest of your day. And like I said, please do not hesitate to reach out about anything that you're thinking about.